Welcome to the 2022 annual community briefing for the Hazelwood Health Study. The next speaker probably needs no introduction. Matthew Carroll from the School of Rural Health, Monash. I'll invite you to provide some local perspectives in your role as co-principal investigator, Gippsland.
Thank you. And before I move on to the next slide, just really wanted to, as I think Faye said and Bridget said, we really do want to thank everybody who's involved in the Hazelwood study, the participants who've done surveys over time, who've done clinical assessments. That's hard work, turning up for an hour and a half of clinical assessments. As Faye said, regardless of the flood and the fire and everything else, it was an interesting time when we were doing the last round of assessments. So really do appreciate the hard work that people have done to come and help us, and to appreciate the work of the team and all the supporters that we've got, because there's a lot of stuff coming out of the study, but it's only coming out of the study because of the commitment that people have made to it. So as you can see, we're continuing to report on short-term impacts. So that's things like you need to talk about the increased emergency presentations for heart-related conditions in the 2.5 years after the mine fire. So we're still releasing some of that early stuff, but we're increasingly focusing now on long-term impacts, such as the work I just presented on ongoing distress and its association with physical symptoms, and the work that Faye was presenting and so on. We're starting to get some reassuring findings. They're still to be confirmed, but we're getting a sense from some of the findings from the adult respiratory stream and from the health clinical assessments, and some of the things we saw in the clinical assessments in 2017 may not be showing up again in the last round of assessments. And that'll then get confirmed in the next round. But that's actually what we want to see. We want to see that some of those effects wash out over time. But we don't know, we can't confirm that yet, so let's see how we go in the next round. And we're really keen to try and provide more information that's of general relevance to the community. And I think Tyler's survey, the long-term respiratory survey, is particularly interesting because it's actually asking new questions. They're not really Hazelwood questions, though Hazelwood's part of the analysis plan. But it's more about what's the relationship between black summer and COVID-19 and eating patterns and respiratory health. So there's a potential there to get really interesting findings of very much relevance to the community going forward. So I think that would be quite good. And we already know, as we mentioned last year, there's a close intersection between the work we're doing and the work that our friends at the Assembly are doing in terms of the collection of food data, because our data from the first cardiovascular round informed the My Health swaps and other activities that the Latrobe guys are doing now, and now we're collecting more health data as are you, and so we'll bring our pieces of the puzzle together with your pieces of the puzzle to try and to really shed light on healthy eating patterns in the region. So where next? So for those that don't remember, the Hazelwood study was funded as a 10-year program of work by the department, but there was recognition at that time that some of the questions will not be answered in 10 years, particularly things like cancers will not be apparent in 10 years, and that there was a need for further work. So we're now thinking in that space as to where to next. Our first priority is to make sure that when we get to the end of this 10 years, that everything we've done actually is made use of. So we're trying to get our research findings out to all the potential stakeholders. We've got some examples of research summaries over in the corner there. They're all up on our website. We'll be looking at sending them out to community locations, but we're really keen to talk to the community about what we found, and not just in these you come to us things, but we go to your groups and come out and say, well, this is what we've done over the last 10 years. What does it mean for you? Where can we take it next? But also to talk about where we could go further. So as I say, we're really keen to see the study continue. We're working on a possible proposal for future funding of the study to go perhaps beyond cancers, but to look at how the health cohort grow up into young adulthood, to continue all the wonderful work of the Hazelwood stream in terms of data extracts and so on, to understand the health of this community going forward. So there'll be a lot of conversations that are going to be started and continued over the next 2 years about where to next, what to do. If you've got comments or suggestions, raise them in the next couple of minutes, but also you can always email us at any point to our contact email address. If you want us to come out and speak to you, centre suggestions, and that's whether that's to a stakeholder group, to a community group, to a health sector, to whatever. Our job over the next 2 years is to come out and connect and show what we've got and where it links into what you're doing and trying to make sense of things.